was fantastic. Would any of our other panelists like to speak to this a little bit?
Hi, this is Tricia. Thanks so much, Kat, and thank you to the whole team for putting this on. I'm delighted to join my colleagues in talking about this issue, and I hope that we get a lot of feedback from the other participants here, and this is a discussion, so use that chat freely so that we can respond to and learn from you. So just before they opened up and brought people in from the waiting room, I was mentioning how polite and diplomatic Senator Jalen is, because she's being very diplomatic about this. So I'm going to come in and be the person who just says it like it is. Okay, so we're talking about people who are not being paid to do a critical job, right? Childcare workers, people who are early education professionals. Those, there are other jobs that are not being paid well, right? Are people who care for our elderly, people who care for the disabled. And this whole care economy is really dramatically underpaid. And there's a massive crisis in trying to hire people like this. And why? Because the pay just isn't good enough, right? For you to say you're going to disrupt your family, you don't have your own childcare. And what is common about all of those professions, right? It is they are traditionally women's work that was done for centuries for free for women, by women. And so now this idea that we have to pay people to be professionals and do some of the most important work that happens on the planet, right, is sort of mind-blowing for people. But if a pandemic isn't going to blow their minds, I don't know what else will. So let's take advantage of the current situation and make sure that we can pay people what they're truly worth in our lives when they're taking care of, our cherished loved ones.
I'll just jump in quickly. This is Becca Roush. It's great to be with all of you, and particularly honored to serve on a panel with these two amazing friends and colleagues here in the legislature. My children are both under 10, so I can in fact speak to what Senator Jalen was discussing earlier in her comments with regard to just how difficult it was. And I have a notable amount of privilege. Where I could, I can sometimes manage my own schedule, for example, and say, nope, I'm not going to have a meeting at this time because I know I'm going to need to transition my first grader from, this online, Zoom learning experience, or what, it was a different platform from Zoom, but, this virtual meeting of his first grade class to the next virtual meeting of his first grade class. And even for us, this was just wildly untenable and unsustainable. I can also speak to the cost of childcare because our youngest is just out of childcare now in kindergarten, and it is more than a mortgage payment, right? I mean, it is just, we have, I believe, according to a recent study, the most expensive childcare in the nation. And if we do not treat really, truly both internalize and treat childcare as infrastructure, we are sunk. We're just sunk. Right there, the vast majority of the people in my district are no longer single income families. They can't sustain single income families, which means both adults, if you have two adults in your household, two people serving in the parent role, or people serving in a caregiver role across the board, right? For older family members or people with disabilities, right? We have lots of people that we take care of. But to the extent that this panel is specifically about childcare, when we're talking about parents, if you have a two-parent home, probably both those parents need to work in order to earn money, in order to pay the bills, to keep the house and the roof over the kids' heads, to be able to feed the children and the family, right? To be able to make those ends meet. And so long as we continue to fail to treat childcare as infrastructure, we will continue to see a gross lack of equity in the workforce, and even I think a gross lack of equity in our elected leaders. Right? This is also something we were just talking about. The legislature in Massachusetts has only just hit the 30% mark for elected women in our 200-member legislature, only just this term. So we have plenty more work to do. And some of that work is happening right now, right? For example, the governor just yesterday signed most of the spending provisions in the ARPA legislation into law, ARPA 1, as we would call it internally. And one of the amendments that I passed to that bill requires workforce reentry funding specifically to be designated and targeted to support women reentering the workforce. Because we know that these barriers to reentry particularly impact women, including childcare. So that language and making sure that that money is actually going to advance women's efforts to reenter the workforce is in that ARPA bill, ARPA law, because it was just signed in yesterday. So, lots of pieces that are moving and a very big picture to continue to work on.
Thank you so much, Sundaresh. Thank you for sharing both your personal story and the reality of so many families in your district. Thank you to all of our legislators. We are a little later in the program going to go a little more in depth on how childcare impacts our work toward gender parity in elected offices. I want to first touch on another thing we've been hearing a lot about this year. There's the Build Back Better bill and a lot of conversation at the federal level about childcare. I know that's something that's being sort of negotiated in Washington, but when a large package like that is passed, how is that funding distributed in the state, and how do families generally see that? Representative Farley-Bouvier, I wanted to start with you on this one, but then hear from the rest of our panelists as well.
Sure. So as people know, all this there's a lot of continue to be some moving parts on it. So I'm couching how this is going to work. But clearly at the federal level, members of Congress, Senate, and truly led by our own Congresswoman, Catherine Clark, have put childcare front and center when it comes to infrastructure. But how do you actually do this, right? Because it's not the same as K-12 education or even higher ed, where there's an actual system, right? We don't really have an early ed system, right? It's a cobbling together of different things. And that's not bad because it gives a lot of people choices of whether you're a provider or you're a parent looking for care, but it makes it really complicated to solve the problems. A big part of it, of the federal legislation, is the affordability of childcare and addressing affordability. Because, as Becca was just saying, it's the same as a mortgage payment that people are paying for it. Some people compare it to college tuition. You gave some numbers around that. So what they're striving for is that people don't pay more than 7% of their income for childcare. Now, what we know from studies is that people with higher income spend about 7%. So that seems like they can do that. But people who are lower income, they can pay up to 1/3 of their income for childcare. So you can see the inequity there. And then it's not hard to take that jump and talk about, inequities when it comes to race. So they are striving to have it no more than 7%. And they're doing it in this interesting way that it's going to be based on the state median income. So if you fall below your state median income, so that's half, right? The lower half of the income by your state, then, especially in those first years of implementation, you're going to get, extra funds to help to pay for childcare. And then as time goes on, of course, the hope is that moves to that for everybody. So 50% of the funds are going to go directly to offset the cost of childcare, the family's cost to childcare. Then 25% of the funds are for the workforce, like how are we going to recruit and retain workforce, pay them, right? And then, how do we build on quality of childcare? Because on the other end of this, we know that high quality childcare is as important as affordable childcare. And how I refer to it is high quality childcare is the secret sauce when we are trying to address poverty. And so it can't just be, a place to park your kid, right? We need to have really good quality childcare, which means we have to invest in the professional development of our workers, and make sure the facilities are appropriate, right? It can't just be, a couple of toys in the church basement or something like that. Like, you really need to make sure the facility is appropriate for children. Is that helpful, Kat?
That's very illuminating. Thank you. If any of our other panelists want to chime in, that was super helpful. Been hearing a ton about it in the news. It's really nice to know sort of a little bit of what this might mean in practice. Any of our other panelists want to jump in with any other comments about it?
I just want to say again that this is a lot of money we're talking about. Build Back Better over the next 5 years, I think, would give us, let's see, I think $9.3 billion. Where's my numbers there? But no, it's 1.3 billion, sorry. But that's not going to be enough, and it's not sustainable. We're going to need state tax dollars to pay for a system that will take care of all children who need it. And it's as important, I think it's more important in closing the achievement gap than K-12 education. So are we going to have money to pay for that? The answer is no, not unless even if we pass the Fair Share Amendment next fall, we will still be struggling to pay for all the needs we have. As we learned when we tried to spend the surplus and ARPA money, there were many more requests and many really needed requests. If people do nothing else in the next year in terms of elections, we have to pass the Fair Share Amendment. And it's going to be hard because people think we're awash in money. They hear that we have billions of dollars in surplus, that we're getting more tax income. That is so important if we're going to meet this need and so many others.
Amen. See, now you're all ambassadors and going to be field organizers for the millionaires tax, right? You've been dubbed.
Sundaresh, I noticed you just unmuted. I have the next questions for you as well, but do you want to speak a little bit to this?
Oh, I was just going to say ditto everything Pat just said. That was it. But I'm happy to take the next question.
Awesome. So we've heard a lot about how important it is to invest in childcare, including in paying our childcare workers and training them. The childcare system itself is pretty complex. There's, private, there's some level of public care and traditionally in-home daycares. Can you talk a little bit about where some new investments should go and how you think that should be distributed there?
This is a great question. There are a lot of different kind of schools of thought about where the money should go in terms of how to build a robust, accessible, high quality childcare system. But the reason that our childcare system was so fraught and so fragile and nearly actually came completely crashing down at the beginning of the pandemic is because it's not a public system, right? It's not like K-12 education. It's not like public higher ed. There is no system. There's no internal administration or infrastructure. There is nothing there to back it up. And one of the real challenges with regard to funding specifically is that much of the funding is tied to families. It is tied to daycare centers that serve families with significant financial need. And that is really important, don't get me wrong, but it it means that the money that gets put into that particular designation actually only serves a fraction of our childcare providers in the state, a small fraction. So, so one of the questions that I consistently ask every single time, whenever we hear from, Assistant Speaker Clark's office, or when we talk about, childcare funding at the state level, is how is this money going to be allocated, right? Where is this going to go? Is it going to go to every available childcare in the state? Or is it only going to go to those centers that serve families with the greatest financial need, right? And obviously, when there's a greater financial need, we need to invest more in those spaces. But a big part of this conversation is both about how to make sure we're getting funding to all of the childcare providers in the Commonwealth, and ease the burden on families who are just struggling to make ends meet, who maybe walk into one of a childcare center. In fact, I had this experience when I was looking for childcare for my first child, my oldest. I walked into one center and immediately started crying because there was no chance that I was going to leave my kid, my baby, in that center. That was never going to happen. And if I had to, and thankfully I didn't have to make this choice, but if I had to make the choice between going back to work or leaving my newborn in that center, I would never have gone back to work, right? That would never have happened. Now, again, I was fortunate I didn't have to make that choice, but some families are making those choices. Some parents are making those choices. And, and we've got some real work to do to build up a publicly supported sector with the infrastructure, the administrative infrastructure behind it, and the funding behind it that actually serves everyone in the Commonwealth. Because when we live in a Commonwealth that has the highest childcare costs in the entire country, we've got a very serious, we've in fact got the most serious problem in the whole nation, right? When it comes to supporting young families and being a family with young kids myself, I can speak to it personally. So there are a lot of kind of nuances about where the money goes. Now, where the money should go and how it should be allocated. Again, there are lots of conversations ongoing about that. And a lot of good ideas on the table, but I think there's some general consensus forming around the fact that we've got to get more money more broadly.
So I do encourage people to take a look at the bills that are currently in the legislature. So Chairs Gordon and Arciero have a bill they referring to as the Common Start Bill. And Chair Peisch of the Education Committee also has a bill around early education. And that there is a very active, robust commission looking specifically at early education and care and how to address these issues. Those are all publicly accessible. There's another meeting tomorrow, and you can listen in on any of those hearings on the State House website. It's pretty easy to find, scroll around and find those on the calendar. They've all been archived, but what they're coming to the conclusion. I listen into a lot of these things, and it's clear that they're coming to one of the big conclusions they're coming to is we generally, when we allocate state funds, yes, as Senator Roush mentioned, it's all mostly driven by helping to support families who are in great financial need, but it also is based on attendance. Like literally, those childcare centers get funds for each day that kid actually attends. Well, that's not how we run fifth grade, right? Like we don't say that if this kid doesn't come on Tuesday morning, you don't get that allocation for that day. Why? Because that's not how you can run a school, right? So why are we asking preschools and early ed centers to fund their centers that way? So they're working on finding a way to support them that's not so tied to literally daily attendance. But it's just, that doesn't work. And so they are looking closely at how to fund that and how to fund it, equitably and efficiently and understanding. But I have so many opinions on this subject. And the more I listen to this commission, the more I'm convinced that the legislators that are in this commission, both the leadership of the House and the Senate, they are equally committed to this issue. It's just so darn hard to figure out how to best do it. But and they're waiting for the federal government, I'm gonna say that, to see what they're gonna do. But they're committed to this, and I really do believe we're gonna find a solution. And there's gonna be a change. Will it be perfect? Well, I never count. But
Nothing we ever do is perfect. I mean, life's not perfect. I just want to add one piece that part of this funding is also about supporting the people working in the workforce. I know we talked about this earlier, right? But for example, there is a budget line item and allocation that supports childcare workers, right? People who are actually working in the field to attain higher levels of education, which in turn allows them to get higher levels of licensing, right? To be a full daycare classroom teacher, for example, requires a certain amount of education that is unattainable because it's unaffordable for a lot of people who are already working in the field, but who have not advanced to that level yet, but may want to, right? So there was a budget amendment that I filed and passed last cycle, I think. That there have been enough budget bills now that that I've lost track of which one it was, but I'm pretty sure it was the last one, right? To notably increase the amount of money there, right? So there's some other ways that we're kind of, working to, to shift around and better fund this sector.
Thank you so much, everybody. That was really helpful and really illuminating. I do want to encourage folks to leave your questions in the chat. We're going to kind of move on to the next set of questions about how childcare impacts our work towards gender parity, but we'll have some time for questions at the end. So if you have any, feel free to share them. So here at the NWPC, our work is working on gender parity in elected appointed office and, at all levels across the Commonwealth, which I know is something that all of you are really passionate about, as well as a number of other folks in the legislature. Generally, do you think that access to childcare impacts our progress towards gender parity, and how? And then we'll kind of drill down on a few specific issues. And that's open to anybody.
So yes, and yes. So I think and I do think that there's some generational change. So if you look at people in my general generation, right, or are older, most of us enter the legislature after the most active time in our parenting. I'm not saying kind of parenting doesn't end, but there really is many less women who are in the legislature when their children have the highest needs kind of in their life, right? And for me, add to that 137-mile commute, right? And it really does make a difference. It's not like I could be in the state house and make it home that night for a PTO meeting. Like that would never, parent-teacher conferences like that, isn't a thing. And so you guys are all living it, right? You women are all living it, right? Until parenting is equal by gender, then women are carrying most of the childcare responsibilities, which means they can't get parity in most professions, right? And that includes elected office. And I don't know a topic that it's more necessary to have representation than when it comes to women talking about childcare. Because if it weren't for women in the legislature, we would not be talking about childcare, period. Men will be like, okay, I'll do it. but they don't get it, right? So it holds women up from being in the legislature, childcare does. And by not having enough women in the legislature, we're having a harder time moving the needle on it.
Senator Jalen, you go, and then I'll go after you.
Oh, well, I just wanted to say that I think it is generationally changing because maybe 10 years ago, I looked at the number of freshmen, at the freshman women and the freshman men coming into the House. And the average age of women was 50 and the average age of men was 30. So that gives them a longer time to build a career in politics if they desire to, and many of them do. But childcare is one, and there's many other reasons that women are later in their political careers, but childcare is definitely one of them.
So I
Thank
couldn't,
you for sharing that. Sorry.
nope, sorry, Kat. couldn't echo that more. You know, and I actually speak now as one of only 2 women in the entire Senate with children under 10. And shortly I will be if voters send me back next term, I may be the only woman in the Senate with children under 10, because the other one is Senator Cheng Diaz, who is running for governor. So she will be departing the Senate, and you know, it might be just me. And there's a reason for that. And in fact, Kat can speak to it personally as well, because Kat was my campaign manager on my first campaign. And let me tell you that door knocking with a 2-year-old and a 3.5-year-old in tow is, first of all, entertaining to watch. Secondly, quite effective in terms of getting people to open the door, because there's, you know, cute kids making some fun noises at your front door and everybody wants to know what's going on, but also extremely slow. Right? They have very little legs, and most of the time you have to carry them with you. Right. And so it is, right. And when I was campaigning the first time around, childcare was one of the big things that people volunteered to do on my campaign, because I couldn't, there was no way to make it happen otherwise. And if I hadn't had that help, and I think Senator Jelen has a similar story from when, you know, back in the day when you were running for school committee. If we didn't have that help, me and my spouse, and we do really pretty equitably share the parenting, we would not have been able to do this. We would not have even been able to launch a campaign, because there's just not enough time in the day. You cannot campaign and take care of kids at the same time, the same way that you cannot work and take care of kids at the same time, right? I mean, it's all the same. It's all the same issue, just manifesting in different ways. And you know, Trisha's right. We would not be talking about childcare if women weren't in the legislature, and we would not be having a really honest conversation about childcare if we didn't have women with young kids in the legislature. And you know, and I'm very proud to be one of them. And I can also speak to how difficult it is. And I don't have a 150-mile commute. But you know, I have a I don't know how many miles it is actually, but sometimes it's an hour-long commute because of the traffic on the pike, right? And that, you know, I have pumped breast milk in the car, right? I mean, this is, you know, sitting, you know, that's just how it goes sometimes. And so it takes an incredible amount of personal work, and a village really to be able to do this, with young kids. And that's just a fact. But it also means that we have far fewer, you know, women. I'm considered young. My children would not say this, but at least by legislative standards, I'm still considered young. And you know, so I've got many years ahead to build a you know, a continued and long career. But it means there's so few of us that when it comes time for, you know, people who have been around for 15 or 20 years and you know, or even 8 or 10 years, you know, we are still a male dominated legislature.
Thank you
should
so
Can
much.
I give a super fun fact?
Ooh, I'm excited about a super fun.
Okay, so according to campaign finance law, you can charge the cost of a tuxedo rental to your campaign if you're going to some event or something like that, but you cannot pay for childcare.
This is a perfect,
Unless,
perfect.
unless you're a federal campaigner, right?
Yeah.
If you, and this is actually a change since I ran my first campaign, right? So it's a change in the last 5 years, right? And Senator Jelen, I know, knows all of this because this is her bill. But this is, if I were running for Congress, I could spend my campaign contributions on childcare. But because I'm running for state office, I can't. And this is a bill that I cannot more fervently support it or more fervently state just how important it is for us to pass this legislation. And it is long overdue. And it is a huge contributor. The fact that we cannot use our campaign dollars on childcare is a huge contributor to why we do not have more women in office, especially women with young children.
Oh, I'm going to take that as a segue.
Yeah, you are.
To talk about Senate 275 and House 769, which I filed with Rep. Joan Moschino and Rep. Mike Connolly. Actually, in I think 16 other states, you specifically can use campaign funds for childcare, and in federal office you can. And in Massachusetts, no one asked, as far as I know, until about 4 years ago, when a candidate for school committee in Somerville asked if she could use her campaign funds for childcare. She was a single mother. She didn't have a lot of money, and she apparently was better than me at raising campaign funds. And the answer from the Office of Campaign and Political Finance was, no, you can't do that. You can rent tuxedos and gowns, and you can take your workers out to lunch, and you can pay for entertainment at a senior center, but you can't have childcare. And childcare, as we said, is infrastructure for people running campaigns. It's at least as important as paying for stamps or consultants or mailings. The way you get votes is you talk to people, and you have to knock on their doors, and you have to go to coffees, and you have to go to debates. And if you're a single mother, or if you're a person who, both of you who work, it costs money to get, because not everybody has volunteers like Becca did, and like I did. I would not be in office now if many years ago, my friend Beth Grunko said, I'll take care of your kids while you knock on every door in Ward 2. So it is absolutely important. We have met some resistance from among our colleagues, which we had to set up a commission because we were not able to get the votes directly yet. OCPF director, the previous director, told us it was a personal expense, not a campaign expense. And other people in the legislature said, oh, you should limit it to the period of time between when you take out papers and when you take office, because the rest of the time you're not campaigning. I think you're campaigning all the time if you're in office or if you're getting started. It's not the way we treat any other campaign expense. And the commission said it should be treated like every other campaign expense. And the new director of OCPF says he could enforce it just like he does for every other kind of campaign expense. Sometimes it's hard. And sometimes people cheat. Oh, sometimes people don't use campaign funds the way they're supposed to. But that's true now with all kinds of campaign expenses. The other kind of pushback we get, and I wish my phone weren't ringing, I don't know where it is. I'm just going to keep talking. They say, they think it's taxpayer money. It is not taxpayer money. It is money that we work for. And there is no part of campaigning that is worse and harder than raising money. So to spend campaign finance money is money that you earned and asked for. So I'm hopeful this year, always. And we have the commission that was set up and reported. So I hope this will happen. I just want to say one other thing about generational, which is that during my time in the Senate, 2 women have had babies, and that is new in the legislature. So we are getting a more diverse, and we are now up, I think, Tricia, you said it was 30% of the House, and we might get up to 30% in the Senate if we have depending on what happens today. But that's up. For a long time, it was a quarter of the House.
Thank you. Thank you so much. I think that's definitely clear. We need more women with young children in office to be able to pass really good childcare. And to do that, we need to be able to pay for childcare. So I'm glad.
Oh, and it's also particularly a barrier for for women who have low incomes, right? Because they can't use their own personal money or their spouse's money to pay for childcare. So if they can raise money, that will reduce a barrier for them to get into the legislature.
Broad piece, for whatever it's worth, was the most irksome oppositional stance for me.
What?
The fraud, the argument that, it would generate fraudulent campaign activity, right? Campaign expenditures. It just, as if women can't figure out how to comply with campaign finance law. Is that really what we're implying here? That was the one that was the most irksome opposition for me, right? We know how to enforce campaign finance law. OCPF is very good at it, right? In fact, there's an enforcement effort measure going on right now, right? With an indictment, or at least a grand jury impaneled with regard to campaign finance violations. So we have systems in place that are fully capable, and people at the helm who are more than capable of finding and enforcing, finding potential violations and enforcing the rules. The fact that this particular thing is the big concern, that was very irksome.
We have a couple great questions in the chat, so I want to move on to our next questions. We can open it up because I know that you're all very busy and probably need to jump off right at 1. But thank you so much for speaking so eloquently to this. Senator Roush, I actually wanted to ask you about another bill that you have right now. So this session, you presented an act relative to pediatric care appointments. Can you tell us about that act specifically and about why having precise language in our acts and our laws is so important?
Sure. This bill, anybody who has ever tried to get your kid scheduled for a pediatric appointment has probably run into this problem, which is that you can't get in after the last appointment for a period of 12 months plus 1 day because your insurance doesn't cover it, right? Insurance covers pediatric appointments once per year, and that's how the interpretation has come out. Now, as it turns out, that's actually a really big problem, right? Because, and in fact, this is also an infrastructure problem, right? We're talking about parents having to figure out how to get their kids to the pediatrician in time to enroll them in childcare, to enroll them in public school, right? In any school, in summer camp, for example, right? You need a health form every year. There are lots of pieces that come aside from the obvious health benefits of making sure you do preventive care on time. But what actually happens with a system that only covers well child visits every 12 months plus 1 day is that kids start getting farther and farther away from their birthdays from the day they're born. And they can never get back on track. Now, and as it turns out, when we did research on this bill, so the bill would change it from once every year to once every 12 months to once every calendar year. Right? Because if you can go every calendar year, even if you have to cancel an appointment or you forget to schedule it, or you're a few weeks late 1 year for whatever reason, or perhaps say there's a global deadly pandemic and droves of families, miss pediatric appointments. If coverage comes once every calendar year, rather than once every 12 months, you can get back on track, which also means childhood vaccinations can get back on track. all of the other pieces of your well child visits can get back on track. All of the rest of the systems work better if we can make this relatively small from a legislative perspective, but relatively massively impactful from a lived experience perspective. And when we did the research on this bill, it turns out that a couple of insurers in Massachusetts are in fact already providing coverage for well child pediatric visits once per calendar year and not once every 12 months. So we know that if insurers like Blue Cross Blue Shield provide coverage once per calendar year, it's actually not a financial strain to provide this coverage because it's already happening. We could just make sure that everybody does it. And because the default for so long has been coverage once every 12 months, pediatricians all across the Commonwealth will just schedule kids, for once every 12 months plus 1 day, right? A year plus 1 day after the current visit. So parents actually have to be much more savvy about their insurance coverage to even find out if their particular insurer currently offers coverage once every calendar year versus once every 12 months. So that's the bill. I'm happy to drop the link into the chat. I see the question there. The bill did have a hearing already. And so we're waiting on the Joint Committee on Financial Services to take action on that bill. But in fact, the Senate chair of that committee is Brendan Crichton, and he too has kids under 10, and his 2-year-old was home on the day of the hearing. And so we kind of heard her like pitter patter behind him in the middle of the hearing. So what an apt time for me to give testimony on this bill as the 2-year-old runs across the Zoom screen. But it's an important bill, and we know it's financially feasible and would make a huge difference for parents.
And who but someone with a small child would think of filing that bill? Just saying.
Thank you.
And for any bill that gets talked about today, and I think a pretty easy and straightforward action is to contact your own senator or rep and say that you support it. Like, so wherever you live in the Commonwealth, you can do that. And if you just happen to be a staff member, somebody that's in the legislature, go ahead and, tap them on the shoulder for that.
And I see Nora Bent is here, and the the Caucus of Women Legislators, I believe, is in favor of it this year.
We love Nora here at the NWPC. I'm glad she's here today. So sort of related to that, one question we had in the chat here is when we were talking about campaign expenses. One of our attendees today asked about getting women in certain districts to pressure their legislators. If women in different districts wanted to speak to their legislators about this bill, what do you suggest they do?
Call them, text them, email them, say this is an important bill, means a lot to my family, and get your act together and support it. It's pretty easy.
I strongly recommend emailing because we're not in our offices all the time or most of the time. And so I think email is the most efficient way, and making it telling a personal story if you can.
I agree. Several of us have also started started a long time ago doing virtual office hours. So, I host a virtual office hours every session every month. Usually you can sign up for slots online. And so you can sign up to talk to them directly and to talk to us, right? Talk to us and our colleagues directly through a Zoom just like this, and say why any particular bill is important to you. That personal story, I think, is really, really impactful, right? What does this mean to you? Why is it important to you? And then ask us not only to co-sponsor the bill, it's usually the ask that we get, but don't stop there. Don't stop at just co-sponsoring. I mean, ask us for that, but don't stop there. Ask us to advocate for the bill's passage, advocate with the chairs of the committee to, get the bill out of committee. And then once it comes out of committee, if it gets a favorable report, advocate with, if it comes back to the Senate, advocate with the chair of Ways and Means, or advocate with the Senate President's Office or the chair of the Rules Committee. And I'll drop a link into the chat about how a bill becomes law in Massachusetts. which is part of a very short, but hopefully soon to be revived video series that we did with Representative Robinson called Low Budget Beacon Hill. It's an extremely low budget video series, but it does kind of break down some of the ins and outs of, of how this works. How does it work behind the bricks? And so hopefully that will, give folks some insights. We've had some positive feedback about it, so I'm going to find that now.
Great.
Thanks so much. I know we have a couple other folks that had questions. If you still have those questions, just raise your hand and I'll unmute you so you can sort of stand up and ask directly. But we have about 5 minutes left. So if there's anybody else that wants to. Yeah, absolutely, Dawn.
I know that we've heard from President Karen Spilka about a moonshot opportunity to provide intergenerational care. How does that fit into some of the ideas that are being talked about at the State House?
I guess I'll just say that, I really appreciate the approach she's taking because she clearly gets it around the whole care economy is about elder care, disability care, and child care. And, how do we bring those generations together? So it just, to me, it shows great leadership and kind of a visionary approach to things. And, we talk about the moonshot, we talk about once in a century opportunities, and these once in a that's a real thing. This is FDR type of opportunity to invest and make change, and we need to do it really, really well, because these same children, for example, Chelsea talks about her 4-month-old, she's going to be paying for these investments. She's going to be paying, this is actually our money. It's not even our generation's money. We're not going to be paying it back, but the kids are going to be paying it back. So we have to do it. It's a very sacred responsibility we have right now to invest it well.
I think the intergenerational piece is hard because we're going to have to be developing infrastructure very fast for early childcare. But at the same time, we're shutting down so many nursing homes and rest homes. So that is an opportunity for some places where there's a nursing home with excess capacity that we're hoping to repurpose some of the nursing homes, but and so that they might incorporate childcare and other forms of care. But it's not going to be a solution for most places. There's going to have to be a very fast ramp up in early care if we're going to provide the care that Build Back Better or Common Start envisions. And we're going to have to develop a workforce very fast while that workforce is shrinking. So this is a big challenge, but it's a good idea. I think, older people can really benefit from being young with little kids, and little kids can benefit with being with older people. And as there are fewer intergenerational families, having opportunities in your daily life is a wonderful thing.
Thank you so much. Dawn, that was a great question. We have one more in the chat. I know that we're running up against the clock here. Anna has a question as follow-up to the standards of childcare, and asks if the EEU regs are appropriate. This isn't somewhere I have expertise, so I hope that can someone speak to that.
I'm not sure what the EEU regs, what are the EEU regs? I usually see EU and think European Union, so that couldn't possibly be it.
Early education and care, maybe.
Right, so, but that's not U, that's C.
Right.
I asked the question if standards are being considered as you're talking about cost and availability. And I was wondering if we're talking about the standards. Somebody responded and said these are covered in the EEU standards. We know that that where a child goes into the first grade tends to be the gap that they leave high school. So childcare is more important than just caring, having the child and holding them. There's a certain amount to prepare that child for school. I was wondering if that's being considered in any way.
So I would agree, Anne, that that's really important. And I think that these regulations are being considered, and they have, I would say that that's the big work that's been done over the last several years, is to really strengthen those regulations. And I gotta say, sometimes the regulations aren't appropriate and are really just a cost to a daycare center. So I'll give you a quick example.
What I was afraid of, yeah.
Sometimes that happens, right? So there was a whole thing about how far apart the slats on a crib could be, right? And you had to make sure all your cribs, I'm making this number up, instead of being, a third of an inch apart, had to be a quarter of an inch. So daycare centers had to replace all their cribs. Well, it wasn't too long after that a new regulation went in to say that all cribs had to be a solid piece of plexiglass, so you could see through that, and there weren't any slats, which just meant they had to go and buy all new cribs all over again. And you're just like, really? Like, these are very costly things for what essentially are small business, but they're small business women. It says small business men. So,
Thank you.
I agree with Tricia that I have seen examples where there was way over regulation. On the other hand, having high standards is extraordinarily important, and Massachusetts has the highest standards and the highest costs, and they're related.
So sorry, I have to jump because I have to go to.
Good afternoon, everyone. I
committee
realize
hearing.
we're a couple minutes after 1
You
o'clock.
can, you can hear it starting in the background.
for a couple more moments for Senator Roush to
everyone.
join.
Thank you.
For being here. Yeah, thank you everybody so much for being here today. To our panelists, thank you for taking the time. To all of our attendees, thank you for being here. This is our last event of 2021. I'm glad we ended on such a high note. If you're able to support the work that we're doing here, we are about to wrap up our year, and we'll drop a donation link in the chat, and would really love and appreciate your support. We want to do more programming like this in the new year, as well as a new young professionals set of programming that we're really excited about, and a number of other exciting things. So we'll drop that link in the chat. Thank you so much for being here, and we really appreciate all of your support.
Oh, can I make a quick thank you? I just wanted everybody to know that Kat was a Barbara Lee Fellow in my office 3 years ago. And, I feel that she went on to, as she said, run Becca Roush's campaign, and I'm really still grateful for her work, and I'm grateful for the opportunity to help young women get started. So if you know other people who want to apply for Barbara Lee fellowships, especially if they want to work in my office. But I think it was a good opportunity for her, and it was a great opportunity for me.
Sabrina, thank you so much. Yeah, it was an incredible opportunity, and it's where I learned why government's important, like in a real sense, which made me realize why I wanted to work on campaigns and help get more awesome women into government. So I think it's an incredible opportunity for folks. Thank you.
I'm just going to make a quick pitch and say, you too could intern for Kat Klein now. So if you know anyone, Senator Jellett, I appreciate you sending them to Barbara Lee, but I want them for our program.
Oh, well, can I give another shout out? Because when I have hard campaigns, I get interns from the Women's Political Caucus, and they are fabulous. So I apologize. It's a different period of time.
Right. Thank you, everybody. Much appreciated.
Thank you so much.
Thank you all.
Kat, you were great.
Thank you.
Antigone, are you still there?
I'm gonna go lie on the floor.
Yes, absolutely. Lie on the floor. No, that was terrific. You did a
Oh, thank
terrific
God.
job.
My first time moderating anything. Here, let's turn off the recording so I can be like, oh my God.